Great. Okay, well, if you thought I talked fast on that last part, wait for this part, because I only have 5 minutes. Luckily, in New York, we know how to talk fast. So basically, I think our main purpose on this panel is to illustrate the degree to which integrative health and whole health is really a team sport. It's not something that the physician does alone. It's not something the nurse or the acupuncturist does alone. It's something we all have to do together. And so I'm going to just share a couple of examples of VA programs that really illustrate that, and I actually have some data that's accumulating of really successful outcomes, just so that you see how we're approaching it in the VA. A really core part of this whole concept is that this is care that has to be delivered by a team. So the two examples I'm going to give, the first one is from Atlanta and one is from Tampa. The first is the Empower Veterans Program, or we call it EVP, Intensive Whole Health Coaching for Veterans with High Impact Chronic Pain. This is specifically a pain program, but it really aims at the whole person. So it aims at the pain and the person's experience of pain. And the lead on this is a wonderful guy named Michael Sanger, who's been really leading the charge on this in Atlanta and is now working on spreading this to a number of the sites around the country. And so what is EVP? It's a 10-week group-oriented program, 30 hours total, and it includes 3 different approaches. So there's this whole health kind of coaching or reorientation approach, and that goes along with mindfulness training. There's acceptance and commitment therapy, which people may or not be aware of. It's a very powerful sort of modification of cognitive behavioral therapy that really focuses around values and what's important to the patient as part of the core healing. And then there's a mindful movement component. And basically, every time veterans get together, and this is just half the course, but I thought I'd show you, they have a 3-hour experience that includes all 3 of these approaches. So they move, they talk to each other, they practice mindfulness, and every time they do it, they come back for 10 weeks running, and they experience each of those things. People are referred into this. This really looks to serve a pretty intensely in-need population. It's a pretty intensive approach. If you think about committing yourself to 3 hours a week for 10 weeks, it's a big commitment. So a lot of the guys in this are really significantly disabled on significant opioids or other medications and really ready for the help. So this is not sort of the whole health light that just everybody participates in. So they've done some great research. They've had almost 400 graduates, I think over 400 now, and they've done before and after estimates. They've shown improved quality of life, less depression, less pain interference, which is what General Schoonmaker was talking about regarding the impact of pain on your life, not just 0 to 10, but what is it doing to your life, improved mobility, et cetera. They haven't been able to look yet at the impact on opioid use, but at least preliminary data suggests that people going through EVP are ending up with significantly less opioid use. And the concept is the pain is no longer in control. So just to show you a few slides, and we don't have to go into this in detail, this is a measure on the right-hand side of your slide. There is pain interference. These are what's called effect size. So delta, I can't remember, it's, who's D effect? Cohen's D. Is that the right? Yeah. So this is the size of the effect, and anything over 0.3 is a pretty significant effect. And you can see that the change from before to after in the impact that pain is having on people's activities, social life, work, et cetera, quite a significant effect before and after EVP. Also looked at pain acceptance, which is sort of in the same category, and you can see the change before to after, also significant. Quality of life. There's a questionnaire they use about depression, and obviously, as you know, suicide prevention and activist treatment of depression, a huge priority in VA now, so significant improvement on depression. And then one of the questions on the PHQ-9 is actually about suicidal thinking, and also a significant decline in that from before to after the program. And this is just to give it a face in one person. I can't unblow myself up, but I can change little things. And before you know it, chronic pain goes from pretty much the #1 thing to something that's just kind of in the background. So it's not about getting to 0 on the pain scale. It's about you might stay at 6 or 5 or 8 or 4, but it's in the background. I have a life. I have new skills. I have a way to make this bring meaning back into my life, even while I have the pain. So this is just one example, and you saw the team there, chaplain, social worker, rec therapist, and the physician is kind of in the background. So one other program I want to share, and I'll talk even faster now, this is called the Thrive program. This is one that does involve the physician directly, but also a whole other team. The lead here is Jackie Pakel, who's actually an OBGYN at Tampa, and who developed this program and is now spreading it around the country. It's been primarily offered to women. She's a women's health doc, and she started this program in women. But now it's actually being piloted in men, so we'll see how well the benefits that we've seen in women veterans translates over. So who is the team for this? The staff for this is a physician or an NP or a PA, a social worker, a psychologist, and then a number of guest speakers from specific disciplines. I'll show you who they are. This is actually a 14-week course. It's 2 hours each time, and every time they do it, they do mindfulness, they have homework, they usually do some movement, and they do that weekly for 14 weeks. This is the team, the physician, the social worker, psychologist. They bring in a pharmacist, they bring in a rec therapist, nutritionist. MOVE is a weight loss program in the VA, so they, at the different parts of the program, they bring in different practitioners. And it's really a team approach. And one thing that's really great is that this has been built as what's called a group medical visit. So when you talk about sustainability and the ability to pay for it, this actually allows the visit to be, quote, billed or counted as a physician visit, but because it's a group experiencing all at once, they get a lot more out of that physician time, but the physician also gets, quote, workload credit for leading a group. So it's a very powerful sort of model for how this can be financially sustainable across VA. These are the goals, also aimed at employees and improving their experience. These are the core components of the model. It includes positive psychology, acceptance commitment therapy. That's a common theme. This is very popular in vets, partly because there's so much, quote, moral injury where the meaning of their life needs to be presented in front based on the challenging memories and experiences people are dealing with. So, and it builds in mindfulness, exercise, etc. So just a little bit about their data. They've had data on 160 people so far, although this is spreading rapidly. And you can see the before and after improvements in depression, anxiety, satisfaction, and neuroplasticity, which is about sort of the ability to respond to change and stress. So really, again, impressive results. Dr. Paykel just recently went to New Orleans and trained a group of practitioners there to bring this to the New Orleans VA, and really there's a lot of interest in spreading this around VA. One question I have is whether this is going to work in men. Obviously, we have a lot of women veterans, and even if it works primarily in women, that's okay because we have a lot of women veterans in need of this. It's going to be interesting to see if the social support and kind of this group approach gets as high an uptake in men. Will the men really come through week 14, or will they get to week 6 or 7 and say, when are the women going to get here? And then, perhaps drop out. That's the fear of the, and so they're actually looking at, is the 14-week model also right for men? I don't need to generalize about men, but, is the 14-week model right? Is a shorter model going to be more effective? And so they're just now rolling out their first few groups in men veterans to see how effective that is. So again, just another example of how this is really an interdisciplinary effort. This one does happen to involve the MD. They're not, they're just part of the team. And so this is really the way we think it should go, that it's a team sport and it sort of takes a village to make this whole health approach work. I'll stop there.